The International Forum for Promoting Homeopathy is about to begin its 1998th day of continuous webinar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have the local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. The purpose of the webinar is to take homeopathy to every home around the world. Now I am handing the mic to Dr. Saror Arora to begin the session. As you all know, today we have a discussion about the scope of homeopathy and how homeopathy can be developed into a big system so that those who miss, as we all know that a lot of students and doctors are struggling to get practice and how we can improve their practice and what are the things to be done, what are the things not to be done. All those things will be discussed. So what the importance of finishing school and all those things. And it's up to Dr. Saru Arora to begin and to introduce the uh, panel of panel members to the audience, and you can go ahead. Welcome, Dr. Saru Arora. Dr. Saru Arora is the moderator of the session.
Thank you, Dr. Dinesh, for giving me the mic and the responsibility of carrying this panel discussion to a logical end, as we have always done. Now, before proceeding further, I doubt that Dr. Shamal has joined in today.
He is there, I think. He was there already.
Dr. Shamal, if you have joined, kindly.
No, he has not yet joined. I have just talked to him. He will be joining now.
Okay, so no problem. By the time Dr. Shamal join, who is the current president of the HMAI, I would like to invite today our esteemed and distinguished panelist of the day, Dr. Bhaskar Bhatt sir, Dr. A.K. Gupta, Dr. Shamal Mukherjee, and Dr. Sani sir, and I would be moderating the session. And as like always, my job or my purpose is to keep the things on track. So I would be intervening in between your thoughts. So I apologize for that intrusions in between if the time goes beyond. So without taking much further time, I think the introduction, let our talks gives the introduction. So today's topic is bridging the gap. Now, why there is a gap? We all know that there is a gap. Are we producing the doctors or the degree holders, and the gap between the clinical excellence and professional competency? Now, the two keywords, the excellence, clinical excellence and competency. These two things we are going to discuss today. So I would like to start straight away from Dr. Bhaskar Bhatt, sir, by the time Dr. Shamal join. So, sir, do you think the current homeopathic education prepares student well for the real clinical practice? I will come to the question why I'm asking this, but
I can understand.
Yeah.
So good evening, friends. It's pleasure that this is a subject that was very close to my heart since years actually, and it's a chance that I'm getting to discuss about it. After 48 years in the practice in the clinic, I see a painful divide. Our institutes are excellent in teaching students how to pass exam, but they are failing to teach them how to heal. We are graduating Encyclopedia of Mathematica. All students they learn by heart the syllabus, giving good examples, good writing, but they cannot trade the living case. We are producing degree holders. The doctor is often born years after painful trial and error. It takes 10 years or 12 years. I will be very frank with you. I truly applied mathematics in a right way after 10 to 12 years of my practice. I passed in 77, and by 78, 79, 87, 88, I learned that this is to be applied in this way. The practical part was missing in the college, and then I was learning it by conferences, by seminars, etc. And it took a long time. If you allow me, I can go ahead about further about this.
So I'll come to this point very soon because I will be connecting dots. So
Dr. Dhanesh, kindly make co-host Dr. Samal Mukherjee. He has already joined now.
Sure, sure.
So I would like to first invite and welcome Dr. Shamal Mukherjee, who has just joined. And Dr. Shamal, we have just started the conversation about bridging the gaps, the clinical excellence and competency. And as Dr. Bhaskar Bhatt said rightly that he used to go in the conferences and workshops to learn. And I think the same story continues. So I would like to ask now Dr. Shamal Mukherjee the same question. Now we know the gaps, but why there are weaknesses that are not being filled in for past 50 years now? So what's your take on this? Why there's a gap?
Yeah, unmute yourself. You have to unmute yourself, sir. Dr. Samal, you unmute yourself. You are muted and your video is also muted. Dr.
I think
Samal?
by the time Dr. Shamal, struggles with that technical issues, we all understand that happens. Let me pass on this question to Dr. A.K. Gupta sir. Ki why according to you there is a weakness despite having so much of infrastructure, so much of claim that we have the biggest, we have the biggest hub of homeopathy in all over world, including the schools, including the colleges, including the infrastructure, but there is still a gap between the clinical excellence and professional competency. So, Dr. Gupta, sir, what according to you is the reason for this gap?
Hello, audible?
Yes, yes, audible.
Yes, sir.
Actually, your question is, hello, good evening to everybody. I'm sorry for my late joining to this meeting. Your question is most probably what major gaps do you see in fresh graduates?
So we are just starting the conversation like few minutes back only, and we have seen
Oh,
that there is a gap between the professional excellency and competence, and this gap has been consistent for past 50 years now. So even we talk of the new graduates or the graduates when we graduated at our time and we took help of these finishing schools or the external agencies to acquire that professional excellence. But we know that we have the biggest infrastructure in homeopathic education right now. So what, according to you, why there is a gap? So we are just brainstorming on that why having the infrastructure and the outcome, the expected outcome, both are not the same. So why there is a gap between these two things?
actually, gap at this moment they are away from the books and clinic. Actually, at this moment, very much easily availability on the modern gadgets, and AI has made their life distracted mainly. The average, mainly the average concentration, the power of on human is now even lower than the goldfish. Lack of interest in the clinical exposure and MCQ based learning is making them at least interested in holistic of learning. I think at this moment, very short from in our hand in our subjects. Uh, so many either computerized or varieties types of gadgets in this at this moment. That I think at this moment, so many students and maximum far away to books, original books from original books. Uh, that's why I think there is a one of the gap and the learning process
Okay. Thank you,
at
sir.
this stage.
I'll come back to you with the further questions on this aspect. And let me take into loop Dr. K. Gupta. So, sir, we know that there is a gap. There is a gap between the qualification and the competency. So, do you think that there's actually a gap, or we are just ignorant? Now,
Uh,
why I'm asking you this question, because it is not always that we are to blame the agencies. Okay, fine, they are not providing this and that, or we are not providing this and that. So, do you think there is a gap? And if yes, why there is ignorance from both the sides?
Hello, am I audible?
Yes, sir, you're
Yes,
audible.
yes.
I think the first and foremost important thing is between all of us is the qualification what we've been giving in the colleges. They've been more of a theoretical, and the more aspect when you come to the practice, you need to be more in a practical shape and practical kind of a thing, which are being missing the exposure of late. Of course, now it has been started, but during our time, I mean, in the past of a couple of years, the the exposure to the practical side of on the clinic was quite less, and the people used to get training from their seniors, from their I mean some their relatives or those whosoever they were having any contact with. They could go there and they used to learn from there and they used to practice. But if the very idea of combining this theoretical aspect as well as the practical aspect is given into the colleges, I think far less people would find the difficulties in coming to the practice and giving the best for the homeopathy. The another aspect which came in between was there have been couple of mushrooming of different schools, so students were quite, I mean, at a loss ki which one to follow, because everyone was saying that this is the right way of homeopathy. And when they talk of this is the way of homeopathy, this is the right way of homeopathy, the students used to get confused. Which one is the correct one? As they when come into the practice, they learn I mean, there have been people who have been giving totally on pathologic prescription, and there have been people who have been giving only on the, I mean, miasmatic, and there have been people who have been going only on the, I mean, one-liner symptoms. So those things have been little confusing for the students to carry on, and this is what has basically, I mean, brought a gap in between the education and the competency of practical side. That's what I feel.
So I will pass on. I will come to Dr. Bhaskar Bhatt, sir, who is like who wants to contribute his experience to this aspect. Why
Yeah,
there are so many schools?
I got it. To be very frank, we have replaced the unprejudiced observer that has been told by Dr. Henneman by with the repertory technician. Most of the students, for them, repertory is a technically it is used with the computer and they find out the rubric without knowing that you should be unprejudiced observer to understand what is wrong with the patient and what kind of symptoms should be selected. So they learn the law of similars in books, but they don't practice accordingly. They don't know how to practice that. That is one part. Secondly, what they are missing is they should be actually taught in under the guidance of a supervised clinical expert. They don't do it. They simply don't attend the clinics and passed out. So they are missing the key that how to select a rubric, how to go to a repertory, which is a better observation, but they simply go for a repertory totality, which is always wrong when they are taking a wrong rubrics or wrong idea of the history. There is another part. Actually, that's equally important. Our masters, particularly Dr. Henneman, Bonu Hussain, Kent, and Clark, they are the four people who I will say they are the pillars. They gave us different ideas, and every idea was important. Unfortunately, these people stick to the guide or whatever they have understood, and they go on. They don't know. They just pre-provided question framework in the case paper. They ask the question accordingly, and they miss the PQRS. They never realize that patient want to say something, but they simply say, see this questionnaire and answer it. And those questionnaire doesn't contain the real PQRS symptom or personality doesn't come out of it. Over reliance on the repertory is there is a search engine in the computer which they use, but it's a tool. Actually, with this tool, you cannot handle the emergencies or certain acute conditions because you have to look at the patient, you have to observe, you have to see it. Lack of interaction with the patient regarding the lifestyle, this is important. This is what they are lacking. So they are unable to come to the remedy.
So I'll pass on this question to now Dr. Shamal Mukherjee sir, that why, because now we are discussing that because of the less of practicality in homeopathy, less clinical exposure, the drifting of ideations. Now, sir, according to you, what went wrong? Why there, why the gap has been developed? So would you like to contribute to this aspect?
Dr. Syamal Mukherjee, you are not muted. You can start, Dr. Syamal.
Can I?
So I think by the time the technical glitch is over, then I would like to pass this question to Dr. Sahani sir, that what went wrong? What do you want to contribute something to this aspect? Because we have discussed like three things right now. So any fourth aspect of this gap?
Thank you, Dr. Saurabh. This is very relevant in the present scenario. What I feel, being a teacher and teaching for the last, I think it may be about 25 years or more, and then also in the clinical practice, what I see, those students who came closer to us, and because they had the regular contact with us, so they become very much efficient with the clinical process. So a clinical exposure is one of the important things. What I feel that at the institution today, I was delivering I had a class on the bioethics for the PG students. During that courses also, what I observed among the PG students who are now the second level of the practitioners, they were not able to understand the practicality of the practice. So they have become more theoretical. Why? The internship period, it is not well addressed by the either the institutions or the students themselves are they find that now it is okay and now it is a time passing. Yeah. So this motivations is very much important that I feel it has to be uh, promoted among the by the college authority to assure every student. You can just compare at NIH, National Institute of Homeopathy, where you see that there are more than 5 to 6,000 patients, and every interns and PG students, they get at least 50 to 40 patients per day.
Sir, I'll come to this woo factor very soon because this is in line. So now Dr. Bhaskar would like
Yeah.
to contribute to this aspect.
I would like to add something. See, somebody wants to be a surgeon. After MBBS, when he go to a surgery course, actually, in that 3 years, when he first holds the scalpel, it is under the supervision of a senior surgeon. That's the way he learns the surgery. Homeopathic art is a surgery of the dissection of the mind, dissection of the whole life story, and to understand what is important, why somebody is sick. So every student who learn under the supervision of a senior homeopath, he is doing it much better. That is not been done or not been happen in so many institutes. That's a lacking part, and this is very important. They try to understand. They should learn why every word is important or which word is more important, why every symptom is not important. The certain rubrics or certain you can say, precarious symptom of a patient, is really important to go for a remedy. That is a very minute part which only a senior teacher can teach actually. And that is what's happening. Everybody who is teaching at home with one or two or three students, they are teaching it much better than the institution where there are plenty of patients and there is everybody want to know within minutes.
So, sir, I would like to pop in here because now we are discussing the the motivational part, the practical part, the ideation part. Now, again, I'll come to Dr. Mukherjee and throw a direct question: the role of administration in creating this gap over the years, because we now all of the things are converging that good doctors should have students so that the student should become good doctors, right? So but there is a gap. So how the administration challenges or the hurdles played the role, for this gap?
Hello, audible? Hello.
Yeah.
Yes, sir, you're audible.
Actually, I'm so much disturbing net connection. Hello.
Yes, sir, we can hear you in between.
Hello. Audible?
Yes.
Yes, yes.
Hello.
Yes, sir.
Actually, unfortunately, we are walking towards that only. We must remember our science has a stark difference from other medical science. Actually, the approach to a curative medicine is way different than others. And it requires to close hands. I think on the training from a teacher. Actually, this our subject is main thing is the Gurumukhi Vidya. Can't be taught through the examination and MCQ. Thus, I think we need to be very cautious to protect and kind of training arrangement in so many items and so many subjects. Mainly basic thing, the clinical approach and in our system. That is the main thing. And another, what is the question, Saurabh?
So we are discussing the probable causes of the gap in these years, and we found that because of lack of homeopathy, lack of motivation, clinical exposure, the shifting of ideations to different schools. Now, I would like to know your views about the role of administration to maintaining this gap, because we know that there were problems. So are we, where are we from the
Actually, mainly, I think that is the at this moment, maximum colleges and hospitals are not go through the clinical practice. You see, now some colleges are okay, OPD patients are sufficient, but maximum institutions are very lack of
कप में डाल
patient
दे
in OPD,
कप में डाल दे
and especially you see IPD system, maximum colleges IPD systems so vacant, patient नहीं आता है properly. That's why the clinical experience is the very lack at this moment. Actually, previously जब हम लोग जब स्टूडेंट था एक्चुअली उस टाइम में जो हम लोग देखा है जो क्लिनिकल एक्सपीरियंस आईपीडी ओपीडी बोथ प्लेसेस बहुत अच्छा पेशेंट भी आता था. आप देख लीजिए अभी स्टैंडर्डाइजेशन देखिए जो गैप जो आप बोल रहे हैं तो जहां पर हमारा जो कॉलेज में जो इंस्टीट्यूशन में जो क्लिनिकल well established clinically, that institution maximum covered up this usage gap. So I think at this moment our NCH must be look after the maximum clinical orientation training in all institution. After that, I think it will be covered, this gap.
Thank you, sir. So now connecting to this, I would like to carry on the discussion because it's a panel discussion, and there are certain points which I think should be opened and directly asked to each one of us. Are we making doctors or are we making homeopaths? So I would like to start with Dr. Bhaskar Bhatts again, because there are two different things. Now we are running after modernizations. This is important. Yes, diagnosis is important. But are we making doctors or are we making degree holders? What?
That's an unfortunate part. This question is really unfortunate because it's the truth that people passed out. They are good doctor. They are not good homeopaths. The reason is homeopathy requires an one-to-one connection with the teacher as well as with the patient. When they take history, they simply try to take the rubrics, go to the repertory. Repertory is a it's an assistance. It is not so it's a search engine where you can go with any kind of rubrics, but it will not give you a remedy unless and until you go to a core feeling, core problem of the patient in his own word and take it seriously and go. Your observation is very important. Students, most of the time in the OPD, they are silent observer and hardly communicate with the patient. Lack of interaction with patients regarding their lifestyle. And second part is there is a they always try to find the shortcuts in homeopathy. There is no shortcut in homeopathy. Homeopathy is an art, and actually the syllabus is so vast that it is bloated with memorization. We are teaching quantity of remedies, but instead of quality of application, we are supposed to integrate clinical bedside teaching from the beginning, rather from the first year, that how this medicine will work, or it has worked earlier. We don't need more hours. We need better hours or better application of the knowledge. They apply knowledge according to the computer, according to the just laboratory, and they go with a remedy which does not cover the PQRS or the core feeling of the patient, and that is the lacking.
Thank you, sir. Now I'll come to Dr. Gupta because he has seen this transition for decades of integrative medicine, incorporating the modern medical trainings and opting and promoting homeopathy. So, sir, what is your take? Are we giving these kind of trainings or integrations at the right time, or what should be the model if we want to, teach them or educate them for these kind of integrative settings?
Thanks, Dr. Saraf. First of all, I would like to say that integration part is a little later, but your first question whether we are producing the doctor or homeopath or the degree or the what I think is we need to the degree is a must for you to be on the board or be on the practice side, but you need to cultivate that particular as Dr. Bhaskar Bhatt has said is the art. So as we say, the homeopathy is the art, but everybody is not an artist. So when everybody is not artist, so he may not be able to, fit himself into that particular category, or as per se, as being examined by or being looked by the different school of doctors, or even as such by the homeopathic fraternity. There is a time when same question, same patient goes to 3 or 4 different doctors and 4 different remedies comes out. So that is one particular issue. The another issue is you say that I've got a headache, tell me a medicine, you are lost. So this is one particular aspect where we all need to work out rather than whether being a doing which particular methodology or something, until unless we develop this some common things. Because you get a call from somebody that he's in a party and got a headache and what to do, he says, "Pally, give me the symptom." So he's not going to do that. And what he needs is he's a homeopathic believer, but he wants some homeopathic remedy to be given to him which gives him some relief. may not be a curative aspect is much later. So what we are lacking is this on the very practical side, which has been a main reason that we are not been able to come to the forefront. People are coming to us as a chronic patients. That is why they've been come to us when they become a chronicity. For acute conditions, they still, bank upon the modern medicine. Now, what I would say that, since I started at OVMs as the first one, the integration. So what I feel is there is no science which is complete in its own. Every science has got something to offer and every science has got its limitation. So now is the time for the benefit of the patient. We should shun away our egos that I am homeopath, I am allopath, I am Ayurveda. We should look forward for the betterment of the patient. What is the best for him at that particular moment? If he, suppose there's a case of status asthmaticus, there's a case of, status epilepticus, he needs, hospitalization, he needs, acute treatment out there. So we should not shun away from there. And giving this particular thing, when he's settled down, you can treat him with a complete, case history, past history, and whatever mathematic background and all that. Then you can do that. So this is the ultimate need, is the integration. Integration for the sake of for the betterment of patient. And we have seen.
I would intervene here because I think I will take that, sir, is this integration a deviation from the homeopathic sciences?
No, I don't think so. Personally, I don't think so. Integration does not deviate you from there. If you see,
this is what is happening. See, we are creating a gap that we are doctors, we are homeopaths, we are this, we are that. So apart from homeopathy, we are being taught everything. We are teaching and preaching everything except homeopathy. So on this is this integration part which is being introduced now, the research part, standardization, statistics, is this a deviation from the homeopathic side because we are not able to incorporate and integrate into one single course?
one thing, see, if as far the research part is concerned and all that, I think we, instead of deviating, we should rather put on stand on our own form. The kind of a research what they've been expecting us to do is not from homeopathic point of view. And until and unless we have our own methodology of research, which is being taken by the authorities, your science will always remain that only कि आपके उसमें कुछ नहीं हुआ, because when he is not an arsenic patient, he will not respond to arsenic. But once you are doing the trial on the arsenic,
I think we have some a few controversial statements coming up. So I'll come to you with this statement very soon. So Dr. Bhaskar sir wants to.
Yes, sure. I will add few things. See, a degree is a permission to practice, but clinical experience is the only way you can learn to practice. With the degree, you are not practicing. Most of them are not practicing homeopathy because it is just permission. Basically, you are supposed to learn it under the clinical experience by the expert teachers or expert who has got a lot of experience. We should teach the student to recognize aconite in a patient rather than tell him to remember 1,000 symptoms from the repertory. No, it's of no use. Unless you recognize remedy in a different way, you should learn that part. The conference is the child of reproduction of result. If they get the result, they are seeing the result, they will reproduce it again in their practice. This is to be done in every case individually. Homeopathy without philosophy is just allopathy with smaller pills rather than the tablet. It's of no use.
And now I would like to say to Dr. Sani.
Yeah.
Okay.
I agree with some part of the Dr. Bhaskar Bhatt and also Dr. But my observations is that I have seen there are many allopathic doctors and they have completed their BHMS after their MBBS course. And this, I asked them why you are so much interested coming to this. And they are better doctor. They are supposed to be the better doctor. Yeah. But
Now,
they are
again,
doing, those who have converted to homeopathy, they are doing much better than us. That I have seen. And I personally, I have
You are
at
right,
least
sir.
3 to 4 doctors are like that.
And
But
more than that,
one thing is that the clinical, yeah, just a moment, sir. One thing
yes.
is that clinically they have got more exposure. And here, and because in the syllabus also there are major parts of the subjects are, they come from the modern medicine side. And only few subjects like mathematics and organ and philosophy, so student devotes less time here. And this is another biggest gap that we have to complete, how to integrate the organ of medicines, mathematics into the anatomy, into the physiology. This integration and this gap, if it is removed, I think it can become much better.
so
I will,
Dr.
I will
Bhatt,
just add, what Dr. Sahani is saying is true. What I am adding is that those people, they were genius who joined homeopathy after passing out MBBS or MD or even beyond that. Why? They know what is clinic, which is related to the organs, and which is something more than that for personality, for image, for his family life, his way of working, his way of thinking, and they recognize those PQRS symptoms easier for them because they can recognize that these symptoms are pathological, keep it. But the other symptoms are special. And even pathological symptoms, they recognize this is strange and peculiar. Why this fellow is not having pain when he has got so much so. So that painlessness become a PQRS for them, which we recognize afterward. We just actually currently producing degree holders who have books, but not the doctors who know how to navigate the patient. We are supposed to navigate the patient to tell to so that he can tell us that what is he, why he is different than others, why he is that, and that is important to recognize to
so
bridge
I
this
would
gap
like
actually. Yes.
So I would like to take Dr. Shamal's take on this. Are we producing degree holders and or doctors, and what is your view, sir? Then before proceeding to now a controversial question in the next few minutes.
Actually, this part is at this moment very important part. Actually, we are always remains a chance for the improvement in our system. We have come a long way. Then researches in different aspects of the homeopathic sciences now being promoted. How to promote it? My question. The contemporary scientific world is now trying to find the holy grail of the therapeutic measures. But we as homeopaths must not forget that first and foremost, we are clinicians who prescribe the medicine to restore the sick to health on the basis of natural law of cure. At this moment, I think colleges, mainly basically our institutions, must be provided with the state of art facility. That is the pathology laboratory and library. But the indoor and outdoor must also be strengthened for clinical exposure and hands-on training. We must be cautious that in the name of modernization, we must not sacrifice the soul of our science. And actually, every science has got a scope and limitation. Our system, our homeopathic systems, also under the how to our where is our scope, where is our limitation. Uh, that's why I think the integration with our system is very important part because uh, our mission and even says only mission is to restore to sick to health as it is cured. Uh, think
Now, I would like to discuss in this section a very, I would say, maybe a controversial topic or maybe a challenging talk or maybe a challenging top. Why finishing school flourished? Now, this is a direct question. I would like to start with Dr. Sani, sir. If we are so idealistic, If homeopathy is everything to us, and if our institutions are so strong, then why students are deviating to the finishing schools?
This is very relevant. So many schools are coming up now. Different schools are coming up. Why? You have to find out. Now, just have an overview of the present NCS syllabus. The present NCS, present NCS syllabus has recently introduced pharmacology. And I saw majority of the students, they were very happy. Because now they are getting an opportunity to know about the allopathic medicines. And this has created a great confusion among us also. Because whether after knowing the importance of the therapeutics process of the pharmacology part, whether the students will stick to it, this is one of the biggest challenge that we have to face. Then, if you go into the history also, you will find that during the Hippocratic time, and who advocated homeopathy and the different way of administration of the medicines, at that time also he spoke about the homeopathic principles. But later on, this homeopathy was suppressed or diminished to lower and almost instinct until this Hahnemann came by to restore it. Why? And Gallen's method and so many other practitioners, they were so much, they become dominant in the practice. So when I think this is going to create a biggest problem, and this is a doctor's. Uh, I agree that there should be the first we are doctor and then we are homeopath. So doctor and homeopath, this relationship is the gap has existed and it will continue until we give proper emphasis on making this learning process for the philosophy and the understanding of the human science. This syllabus needs something change or reconsidered for the present for the coming era.
Thank you, sir. I'll come to Dr. Gupta, sir. Why finishing schools and why not?
I think if we need to survive as a homeopathy in the form of pure homeopaths, I think we should. But there is a very big but, because till date we haven't have got any place or institution per se where we can say the patients are being referred by the doctors of their own problem where they have not been finding, proper treatment and all that. A referral place with reputation, we have not been able to build till date, not even one. That is a very big, drawback in among homeopathic institutions and all that. Now, once these people, those who have started their old schools and all that, because they've been thriving and giving very good, their orators and all that, and to a budding homeopath who is still in, confusion what to do and what not to do, because what somebody's been saying is something different, the other person has been saying something different, and everybody's saying this is a actual homeopathy. So, which is the actual homeopathy? It is very difficult for a youngster to understand till he comes to his own clinic and starts learning from his experiences, from his failures, and from his successes. That is where he finds that what particular method is better. And I personally feel the what we need to see, instead of having one particular module to be fixed with that, you need to see that particular patient what he requires. He needs to go, that particular option, and we treat it, and the patient gets cured. We feel comfortable. So finishing of the schools, which we everybody would like to, but is it possible? That's a big question, because here and there you find something new is coming up with the new philosophy or with the new, because of giving something new, people would always get attracted. That's a latest one. And if you have got some people like in the background, especially the foreigners have been coming to you, so it becomes all the more important for the youngsters to and get lured over there. This is also one of the, I mean, aspect which is very much factual. But I'm not. I'm trying to give the factual side of the situation. Whereas again, ideally speaking, if a person has done proper qualification with the, theoretical and practical experience, he need not to go to any other school.
Sir,
If
I would like to ask one question to Dr. Bhaskar, but sir, because sir, you want to contribute something, or like should I continue
Yes.
the?
Yes, I would like to contribute.
Yes, sir, please.
Okay. See, the biggest problem in homeopathy is we have been told that case taking is an art. We must do something good. Now, as you know, the unprejudiced observer, he must be a good master interviewer, which is never taught. How to take interview of a patient in such a way that he'll come out with a lot of things, and you should be unprejudiced to listen that and coming out with a rapport with the patient and with all detailed symptoms which you would like to talk only to you. It's a art that every finishing school try to teach in a different way. Now, this is easier to see, but difficult to mimic. Nobody can copy them. So what happens? They learn and they try to do it personally, but they cannot do it professionally. And that's the reason they go to the school, they get the certificate, but out of 100 or out of 500 who is attending the seminars, only 50 or 5 people will do it in a proper way. It is not that easy a job, first part. Second part, we have been taught in the college, basically, that Dr. Henneman said, unprejudiced observer, then Dr. Burning Hussain told, every symptom should have a location, sensation, modality, etc. And then Dr. Kent says that there are hierarchy of symptoms, that certain symptoms are having more marks, there are mental journals, and then physical journals, and then for the common symptom. These masters, what they say, they have not been applied properly. Otherwise, you don't have to go to any finishing school. This master from Henneman to Clark, actually, particularly these 4 people, Henneman, Boring Hussain, Clark, and Kent, actually, they gave a better idea to go for it without even having extraordinary knowledge of the language. And they get good results if you go accordingly. Unfortunately, there's a length and people want to have a shortcut. But there are no shortcuts in homeopathy. That is never real because you cure the patient and not the disease. So to cure the patient, you require a longer time rather than cure a particular symptom or pain or anxiety. That is easier. And that doesn't work.
Thank you, sir. Now I have an open question, and I think this is a bit direct question because this is what I feel. On one part, we says that every teacher should be an art. You should be an artist. How to prescribe, teaching homeopathy, preaching homeopathy. But on the other hand, what our administration, because which this gap we like skip that part, but I would like to discuss it here because on open platform our administration says that the teachers are not supposed to practice. Okay, they are only supposed to teach to the students, and they are not supposed to practice because they get NPA or whatever. Let's not get into, enter into intricacies, but they are not allowed to practice or see patients. How we expect those to be good teachers in homeopathy? We are only being taught the philosophical part, but the practical part is being taught by a person who never sees a patient in a day. So do we expect that we would be good homeopaths years later? So I think that is the gap which no one talks about, and that is the reason why we go to the finishing schools. So this is an open question. This is part one. Second part, I would like to quote some keywords which I researched that why finishing schools. So let's talk openly why these finishing schools. So is it because of the rejection that we were not taught good or clinical homeopathy in our institutions? Or is it because of the motivation that these finishing school teachers are more good clinicians and they motivate us, it is because of the lack of content we have in our colleges or in our structured syllabus or institutions, or is it because of the magical cure we see or we expect to? Okay, fine, this is a quick cure, go to that school, learn some tips and tricks and you will be successful. So these two questions are, now we have an open platform. Dr. Gupta sir would like to contribute.
Yeah. First of all, Dr. Saurav, you have very rightly said there are a lot of very good teachers, but they are not clinicians. At the same time, they are very good practitioners, but they do not have the ability to teach. So these are the two different aspects of a profession. And very few we find a person who has got both the qualities. He could be a very good teacher and very good clinician, very good practitioner. And unfortunately, as you have said very well, because of NPA and all that, they are not even allowed to. If they are not allowed to, they just keep telling what the books have been saying. And what has been the practical aspect, I mean, achieved by that particular doctor is being missing. And we have seen the observational part, as Dr. Bhaskar has been talking about, the, keen observer and non-prejudiced kind of a thing can be seen in the practical side only. And the other thing is like, doing about the magical cures and talking about those, you create that kind of a sort of aura which lured our people to go on that side, because we do not in the institution we do not see those magical or curative aspect of the diseases of the patient or on the record. And as I earlier said, we do not have got any institution, we do not get any record, any information from even NIH, who has been seeing so many patients. But have they ever come out with any of the observation, or have they come out with any of the rare cases which they have treated also, which has been publicized? So this is one thing which we are lacking in a very, very, big manner, and it need to be looked into and worked out.
Thank you, sir. Now, since we are approaching towards the end of the discussion, I would
I think
like to, yes, I would like to.
Doctor, I was just listening to Dr. Gupta sir and Dr. Saurav, as you have mentioned that this teachers are not allowed to practice. I think it is not so much relevant because the duty work 8 hours to college hours. Every teacher has to be in the clinic. This is very important. So it is only the matter of they are not in some states teachers are not allowed to have a private practice, but in the hospital they have to be there. They have because with only a good clinicians can become a good teacher. And
I agree to disagree, because they have two cadres now, GDMOs, general duty medical officers, and general duty medical officer teaching. So things are, things are taking the very alternate turn, I would say. But yes, this thing we need to, I think, discuss and get it updated, because if we want to teach the good clinical homeopathy, then the teacher should have a good clinical exposure. If he's all the day he's into files only, then what we are expecting, our future generations to be. So anyways, I'll come to Dr. Bhaskar Bhatt sir, because we are concluding the remarks, and then to Dr. Shamal Mukherjee, because we have 5 minutes left. So sir, Dr. Bhaskar Bhatt sir, your opinion and closing remarks.
I'm very clear that every teacher should be a practitioner in the college or private. There should be, without practical experience, nobody can teach. This is the theoretical knowledge which is of no use unless and until he has got a practical knowledge. First part. Second part, all these schools actually, they are good practitioners and they are good orator, and they are able to explain the relation between patient's talk and the repertory or the mathematica. Third part, basically OPD, a full OPD of 200 or 2000 or 4000 people is not enough. A patient should, a student should know a good mathematica of aconite, how to apply it, rather than knowing 1000 symptoms of the repertory where he can find out. Because finding is a tool all computer can provide you. That is not the way to find a remedy. Find a remedy, you should find a better rubric, right rubric, so that you can go to a single remedy which will help the case. So to prepare a good homeopathic doctors in the future, the practical part should be given more important than the theoretical part. That is important part.
Thank you, sir. So, Dr. Shamal Mukherjee, sir, your closing remarks in next 1 to 2 minutes.
Okay, thanks, Saurabh. I agree with the Dr. Bhaskar Bhatt comments and Dr. Shahani's comments and Dr. Gupta's comments. Today's topics is very important topics and big challenges and so many discuss is there. But one thing actually I previously say to you, this our subject is Gurumukh Vidya mainly. But today actually it is an open platform. So that's why I not to open our total thoughts, because today's so many problems in the education system. I think जब तक हमारा क्वालिटी ऑफ टीचिंग नहीं होगा, actually our education system is running on the maximum is the commercially. One thing I think.
It's very bad.
Because-
Very bad. Very bad.
Yes,
It's very bad.
yes. It is true or it is true. I say this
No,
platform.
it's the truth. But
It
you
is
feel sorry
truth
for
or
that.
wrong? It is first my question. Because at this moment, so many colleges are formed where I see no OPD patient, no IPD patient, but papers works is
So,
fine.
I
So many
totally,
OPDs.
but because we are running out of time, so I would have to take a pause here and give back to Dr. Sani sir in the last
Very
minute
good.
of.
Very good,
Thank you,
actually.
sir.
Very many thanks.
Thank
Okay.
you, sir.
And that's
Thank you.
why I know everything, but not to open
So,
this situation.
I think we'll have a separate.
Actual cause behind at this moment finishing the our homeopathic system.
Thank you, sir.
Okay.
Thank you. And last minute, Dr. Sani sir, because we have
because
space,
this
your
time is
valuable
short, but
thoughts.
I can only say that the finishing schools people, why the one important thing to why they, and the only answer to it what I according to me is that because they are lacking something in the main school. So once you feel lacking system there, lacking is there, definitely the students are attracted to the, and so many finishing schools are now mushrooming everywhere, everywhere. Not, I see even just pass out students, and they have started their own finishing school. It is not, and I think there may be hundreds. We know the few of them, but there are hundreds of the finishing school coming up, and they are having a Gurukul, their own type of the Gurukul. They are running a Gurukul type of the teaching. This has to be looked into, and this and only unless, and I agree with all the points are very relevant. Everyone where every main thing is that we must have the better exposure and clinical and at the institutional level. And if the students get the better clinical, they will never, and they only can become a homeopath. Because combining doctor and homeopath, that this is more important. First, we have to be basic point. And I was going through the BK Sarkar notes. If you go through the writing of the BK Sarkar, who is qualified to what qualification is required for to become a homeopath? This question was there, and he said that only well matured with the medical system, and that what I see our stalwarts like Dr. Kent, they all were, even our master Henneman. He was a clinician. He was general medicines, because they have the good doctors. So only good doctors can become a good practitioners, because they have the two, they know the both faces of the coins.
Thank you, sir. So I think it's time to
Actually,
wind up. We have
need to
already.
need to quality of our education system, not the quantity of our education system.
So with this, I would like to thanks each one of the panelists, Dr. Shamal Mukherjee sir, Dr. Bhaskar Bhatt sir, Dr. Gupta sir, and Dr. Madhul Sani sir for their valuable contributions, and will come up with more direct open house discussion very soon. Thank you so much.
Thank you. Thanks a lot.
Thank you.
Thanks a lot. Thank you.
Thank you.
Now I am.
Thank
Good
you,
night,
everyone.
everybody.
Sir,
Good
please,
night.
Good night, everyone.
sir, please,
Good night, everybody.
sir, please wait 1 minute. Dr. Shaji Kudiyat, our Vice President, want to say something.
Sure, sir. Very good.
It was a very nice discussion, and I think this will encourage the newcomers and to open up, because lot of changes needed to make homeopathy a number one medicine in the world, and homeopathy deserve that also. But we need to do lot of things to make it happen, and that possibility is with us also. We need to learn where we fail, and we need to readjust ourselves to make our average intellect homeopathy doctor the best homeopathy doctor to fulfill the first mission given to us by our discoverer of homeopathy, Dr. Hahnemann, that is mentioned in the first aphorism. So that is what we need to keep it in our mind. And so finishing schools sometimes needed, because we need to see within 47 years of time after the publication of the law of stimulus to the world, Hahnemann modified the organon 6 times with the 6 additions with the modifications in it. So if we have lived 50 more years, how many times modification might have happened? So that modification to make the full potentials of homeopathy practicable and beneficial to humanity by an average intellectual human being is resting on our shoulders. So we should listen, understand potentials that so many other dedicated homeopathy doctors discovered and brought to us need to be considered, so that this system will become the number one system in the world. That's all I wish to share as of now, because we are too late. Thank you very much.
Thank you.
Thank you, Dr. Shaji Kudiyat.
Thank you.
Thank you, Sahani sir. Thank you, Bhaskar Bhatt sir, Gupta sir. Gupta sir, and Shyamal Kumar Mukherjee sir. And excellent moderation from Dr. Saro. Hope all of you will be back with us, because we are doing the continuation of the discussions in connection with the celebration of IABH 2000. It is to be celebrated on Saturday, coming Saturday, that is on the 21st of this February itself. So we had already 2 discussion sessions before this, and tomorrow we will have the same subject will be discussed by 3 eminent doctors. One is Dr. Shaji Kudir, the other one is Dr. Shweta Singh, and the third one is Dr. Karunagar. So hope all of you will join us tomorrow at the same time. Thank you all. Good night.
Good night.
Good night.
So over to the Malayalam team.